All right. Which of the following is most appropriate management plan for this patient? 8-year-old boy is brought to his pediatrician by his parents who are concerned about his delayed motor skills development and difficulties with learning. They also mention that he is very sociable, has strong interest in music. On examination, the boy has a small upturned nose, full cheeks, wide mouth. All right. Systolic murmur on cardiac auscultation, and genetic test confirms Williams syndrome. Which of the following is the most appropriate plan? Okay. I'm trying to dissect this question a little bit. Not sure really what they're going with. Okay. Very social. Don't remember Williams syndrome, but let me see if I could answer this. Hmm. Itis, cortical airways, daily stretching and strengthening, ACE inhibitor, IVIG, refer for early intervention services and ongoing educational support. Okay. Because this is like appropriate management, I'm not sure if there's something like physiological that's most important here, or if it's just like a sort of more of in that like that social category, which would I think just go to the intervention services and ongoing educational support. Um, let's see, difficulties learning. That's why they came in. Upturned nose, full cheeks, wide mouth, systolic murmur. I mean, I think this was, and then Williams syndrome. Not sure what
Okay.
that is. I don't know if they knew he had Williams syndrome or if that's the first time it's being diagnosed, which
Seems like
could.
it's the first time because it says genetic
Okay.
test confirms. So
Okay. I'm not sure what that is. I'm trying to think of what you'd give you the systolic murmurs we talked about the other day, right? It's like aortic stenosis, pulmonary stenosis, mitral and tricuspid regurgitation, like all on that S side. Um,
also, I forgot to mention the other day, but also ASD and VSD can give you systolic murmurs too.
okay.
I don't think we mentioned
No, we didn't, but that's okay. ASD, VSD, I'll put that on my little note here. So I won't forget that. Okay. All right. Really not sure here. I would just think again on the gut, I would do intervention services. I'd sort of kick
okay,
myself if I
that's
didn't
the
pick
gut.
that.
Okay,
Yeah,
good.
because it's the family medicine, and it's like, yeah, that's what we're gonna do first. We're gonna like try to do some intervention and education, and then probably move into medicine after that if something else is going on. But
Okay,
yeah, I'm not too confident because I don't know what Williams syndrome is. So,
okay,
and nothing's like making me think, oh, we need to do something right now.
okay.
Um,
You want to go keep with this?
yeah, I'll go with it.
Okay, great. Yeah. So, definitely for sure, right? So it's a genetic disorder. I mean, when you get into this situation, when you read this question and you're like, oh, it's Williams syndrome, right? And they give
Mhm.
you a diagnosis and you're like, oh, I'm not sure what that is. But what you can deduce that it's a genetic syndrome, right? Obviously,
Mhm.
right? They tell you it's a genetic test that confirms the syndrome. You might not know what's entailed, right, with that syndrome, but you can be like, okay, so kid has a syndrome, first diagnosis. What do you want to do, right?
Mhm.
So, always the best bet is educational support. You got to, just like you don't know what Williams syndrome, there's no way the parent's going to know, right?
Mhm.
So, definitely for sure, right? You want to talk to them about developmental delays, learning difficulties. Their face is going to look, I think this is the one that looks like elfin features, right? They look like kind of an
Okay.
elf, right? Strong interest in music and are very sociable. They're super, super happy, right? Is usually Williams syndrome, right? So, yeah, it's just about talking about education for right now.
Okay.